Hi everyone. As you probably already know, my name is Sam Sardi. I am a therapist that specializes in trauma, and particularly I love offering EMDR intensives in my practice. If you watch my stories, I did a poll this week about what topic I should cover in this limited series on EMDR intensives, and the front runner was perinatal population. So I'm going to be talking a little bit about offering EMDR intensives in folks who are pregnant or postpartum. Now, using an EMDR intensive for this population can look a few different ways. If you're having any anxiety or just kind of want to augment any positive beliefs or feelings when it comes to giving birth, that can absolutely be done in EMDR intensive. It might be a bit of a shorter intensive, and it might be kind of different than some of the intensives that I typically offer that are more trauma focused. However, that can absolutely be done just to kind of augment and solidify, any kind of positive emotions or imagining yourself coping really well. Something called a future template that can absolutely be done in EMDR intensive, as well as something called resourcing, which is about boosting positive imagery, memories, feelings, etc. that you want to have available to you during your birth. If you experience something like needle phobia, or if you've had medical trauma, if you've had a traumatic birth in the past, I highly recommend looking into an EMDR intensive before you give birth. EMDR is safe to use in perinatal populations, although always the caveat is to talk to your providers about it, of course. And while, of course, birth is just one of those things in life that we have very, very limited control over, by working through any past trauma or stress or adversity, it can really help put you in the position to have, the most grounded, peaceful place to kind of fall back on regardless of what happens, and to be able to kind of establish safety using the resources that you had and the work that we've built on in the intensive to help you feel like you're able to kind of cope with whatever gets thrown at you, as well as being able to enjoy the amazing changes that happen in your life when you give birth, and to bond with your baby. I also want to acknowledge that, in watching this video, you may be thinking about a pregnant person, and birth trauma can happen to the birthing partner as well. And an intensive can be, really ideal to help the birthing partner work through things that have happened in the past, as well as to help them be in a space where they feel grounded in the perinatal period, to help them feel, like they've worked through anything that's come up in the past. And intensives can be done with couples as well. So if the couple has experienced something together, there isn't necessarily a need to separate the two. There are protocols within EMDR that we can use to process the trauma together, and that's something that we can assess and discuss during the consult. Ultimately, addressing trauma symptoms and stress can be critical in optimizing that postpartum period and that parent-baby bond. And so I really encourage you, if that's something you've experienced before, or if you have any worries related to, labor, birth, delivery, parenting, postpartum, the fourth trimester, whatever it is, to, of course, discuss with your current providers, as well as feel free to reach out to me if you're a provider who may have a client who you want to collaborate with, or if this is something you're looking into for yourself, I'd be happy to discuss how that might be appropriate for your situation and to work with you.